In this video, I answer a question from a massage therapist who is having trouble properly communicating to their client that getting a chiropractic adjustment is making their problem worse, and that all they need to do for treatment is get the soft tissue work and avoid the adjustment altogether. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a non surgical expert in chronic pain treatment. My focus is on finding and fixing nerves that become stuck to muscles with a glue like substance called adhesion, also known as scar tissue, and reducing inflammation from chronic pain naturally without the use of medications or injections. This results in a significant increase in flexibility, function, and long lasting pain relief. I'm also the creator of the Peak Method, where we teach overworked massage therapists a new treatment system that cuts session times in half and eliminates the frustration of inconsistent results so they can avoid burnout and help more people get out of pain. All right, so this week's question came from a massage therapist named Carter from Maryland. They are in year 6 in a solo practice that helps people get out of pain and recover better. Question was, there is a local chiropractor in my area who proudly goes around calling himself the Bone Crusher. Ooh, scary. And absolutely just rocks people when they get adjusted. And a few of my clients have been seeing them over the years. I've noticed that after they get adjusted by the chiropractor, they tend to experience more pain and discomfort and want to come and see me for some more relief. When I ask the client if they've talked to the chiropractor about why the adjustment seems to flare it up, they say they were told it was just part of the process and that it's a sign that they probably need to be adjusted more often. How do I communicate effectively to these clients that they would be better off not getting adjusted without feeling like I'm overstepping my boundaries as the other provider is a doctor? All right, let's get into it. So just a quick reminder, I do really enjoy doing these types of episodes and these videos. So if you have any questions you'd like me to answer, send them my way. And if I think I can help, I'll get a video out to you. The information to submit your question is in our profile or wherever you're consuming this video. So a little background on me, why I am an anti-chiropractic adjustment chiropractor. So if you're new to the channel, you haven't been, really consuming a lot of my stuff over the years. A little background on me. I went to chiropractic school. When I first started off in school, I was really into the adjustment. I was like the president of the adjustment club. I thought it was all great. It was awesome. We were popping and cracking and snapping. Amazing stuff. Then we got into this course where we really started talking about the theory and the idea behind the chiropractic adjustment. What it does is called subluxation theory. And that's when I really started asking questions. We continue to talk about the idea of like the bone goes out of place, you put the bone back in place, you promote healing, innate healing of the body, all that kind of stuff. I started asking questions and I said, what about all the structures around the bone, like the soft tissue, the ligaments, the fascia? Like, why don't we fix that so that we don't have to keep doing an adjustment? Instead of like answering my question in a nice way, a couple of the professors were basically like, oh, you must not believe in the healing powers of chiropractic. You should probably drop out of school, all sorts of stuff. So I was really in a tough spot. I was about halfway through and already put about 100 grand into my education and realized that I didn't really see the full validity in just doing an adjustment to help, especially fix chronic pain. Um, so I was at a crossroads and just decided at that point I was going to really get into soft tissue work. I took every soft tissue course you could think of outside of school, got really good at that, did all the things I needed to do to pass my boards in chiropractic, did the adjustments they told me to do. But I've been in practice for going on 15 years now, and I have not performed an adjustment in my practice since 2011 when I first got out. So needless to say, I'm pretty anti chiropractic adjustments. I don't think they're horrible. I just don't think they're doing anything to fix a problem long term. At the end of the day, I want to be in the world of fixing problems long term. But I don't like when chiropractors are just wrecking people and then telling them, oh, you just need to come in more often. Like, that's not cool. That's not something they should be doing, but unfortunately they do. I'm not bashing all chiropractors. I'm just saying there are some out there that are pretty wacky in what they do and what they promise they can do with the adjustment. So here's another thing I really want to get straight. Just because someone went to school and got a doctorate doesn't mean they're automatically superior to you. He even said this in the question. He's like, well, they're a doctor. I don't want to overstep my bounds. It doesn't matter. You do what's best for the client. It doesn't matter what initials are after your name. And a lot of times when people have a lot of like doctorates, a lot of advanced trainings, they get really biased and they get this idea where they think that they're just amazing and no one else knows what they do because they just went to school. There's school and then there's the real world. I always laugh because some of the people in my graduating class that were like the top of my class in like um, grades and acing tests were some of the worst like manual providers in the world. So it's like, yeah, you can think about it like contextually, but if you can't actually do it, who cares? Like, you got to be good at what you do and using your hands. A big topic I talk about a lot is nobody cares about what you do or how you do it. They really just care that you can help fix their problem. They're not searching you because you're a certain provider. Maybe you're like a Jedi master, level 12 master of something. They just want to know that you can fix their problem. They don't care about what you do or how you do it. They just want to know that their problem can be fixed. So, how to help the client come to their own conclusions about the other providers without bashing them directly. I actually had this happen this week, and I kind of caught myself in a moment. I was doing some work on a patient that's had some chronic shoulder issues. We're doing a lot of deep work on like the brachial cords and the subscap. And they said a thing. They're like, "Oh yeah, my chiropractor, did the same thing." And in my mind, I'm like, "No, they didn't." And I was ready to like, kind of set them straight. And I was like, "No, it's not the same. Mine is more focused. Mine's more deliberate. A lot of them are just kind of dabbling in soft tissue work." So I always say be a little more gentle than going there because sometimes when you attack other providers directly, it gives you a bad reputation in front of those clients' eyes. Because a lot of them will just say, "Oh, they're so nice," and they're so. I'm like, who cares if they're nice? But at the end of the day, they don't want to feel stupid. So be nice about it, tread lightly, and this is how I would kind of go about it. I'd ask two questions. And I always do this in my original history taking process when I'm evaluating a client. I ask them a bunch of questions, but if they're like, these people that are maybe like really married to the idea of like continuing to see their chiropractor, maybe their physical therapist, or maybe they have like another massage therapist who's not really helping them, but they continue to go, I just ask two questions. The first question I say, what did they tell you was wrong? And I'm amazed over the years when I say, hey, what did they tell you was wrong? And they're like, you know what? They never really told me what's wrong. And I just go, yeah, it's pretty hard to fix a problem if you don't know what it is in the first place. Next question I say, did any of those treatments help? And that's where it really comes out. And a lot of times what they'll end up saying is like, yeah, I felt better for a day or two, maybe a week, but nothing long lasting. Yet they continue to fixate on that and they continue to go to that person hoping that it's going to magically fix it. They always say the definition of insanity is doing the same thing over and over and over again and expecting a different result. That's what's happening in these situations. And a lot of times I have people that also want to like see me on top of the chiropractor and stuff like that. And then I just ask like a pretty blunt question. I just say, hey, if they were really fixing your problem, then like, why are you here in the first place? A lot of times you just got to kind of call some people out because they're so stuck in the routine of doing the same things, even though they're not working. And my thing is like, hey, if you try like a handful of visits, like 6 to 10 visits with a chiropractor, physical therapist, someone else, and it's not any better, like it's not going to work. Don't continue to go. And I get these people that have been going for like 50, 60, 70, 80, 100 visits. It's like, it ain't working. So try something different. Next is how to educate the client on why they don't need to be adjusted and are better off getting soft tissue work with you. This is what I do all day. I get these questions all the time. They're like, man, you're a chiropractor, but you don't adjust. Like, why wouldn't you do that? Actually, I had a funny story the other day. A patient who came in has been dealing with like chronic stuff and been going to this chiropractor. The chiropractor was seeing him like every day for like a month straight. And the patient told them about what I was doing. And the chiropractor's response was, well, yeah, he's got to do soft tissue because like he sucks at the adjustment. It's like, all right, dude. Yeah, cool. Awesome. Yeah. Keep telling yourself that. Live in your fantasy world. So I do explain to them why it temporarily feels better. I keep it really simple. I say, hey, in your spinal cord, there's two pathways. There's one pathway that senses like vibration and movement, and one that senses pain. When you get an adjustment, it gets these fibers that really sense vibration and movement. They go crazy, they start to fire, and they block the pain. I say it's the same thing when you jam your finger in a door, to kind of shake it out. That's why they temporarily feel better. But just because it temporarily feels better doesn't mean it's fixing anything. Then I like to use the chiropractor's brick out of place analogy against them. They kind of say your bone's out of place, we put it back in place. And I say, well, think of the bone as like the brick, and all the surrounding soft tissue is like the mortar. So why not fix the mortar so that the brick holds in place. And clients get that. They're like, oh, yeah, that does make sense. You're kind of using their own thing. They're like, your bone's out of place. We're going to put it back in place. I'm like, hey, let's put it back in place for good. Let's seal it off to make sure that it doesn't ever pop out again. And I always say, if we fix the soft tissue, then the bone will hold in place and you won't need to get adjusted. And you get to save some time and you get to save some money. So this is me being pretty nice, just educating them, giving them a different perspective. I'm really big on analogies and keeping it simple. I don't say like crazy complex things. I just do things that are going to like be very relatable and they get that. And most people are pretty good at this point. Usually it works, but if not, I just go to the full blunt truth option. I just say, hey, that jack wagon's jacking you up. I just say straight up. I say, you know, if they were really fixing you, then why are you here? They haven't given you a diagnosis. They don't know what the problem is. They're continuing to tell you they're hurting you every single time. Like, it's just time to break up with them. It's almost like you give them permission that it's okay to end that relationship. It's like, cool, they're nice, but like, nice doesn't matter at the end of the day when you're in chronic pain. So start with the education, start very easy, start nice, and then escalate it when you need to. 10 years ago when I was younger and full of, vigor and anger, I would go like right away, oh, that guy's a jerk. He doesn't know what he's doing, blah, 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 blah. And I realized that it was making me look worse because I was bashing them. I'm not going to bash them. I'm just going to help the client come to a conclusion on their own. That's all I got in the video. I really hope it was helpful. This is a common question that I get a lot. If you like the video, share any insights you might have got in the comment section below. I try my best to engage and talk to anyone that has questions or wants to, learn more about what I do. You can do me another solid and share this with other providers that you think it might help. And lastly, if you like what I'm teaching, what I'm showing, what I'm training, go download our free training modules, which go through our full system from the beginning to the end, taking evaluation, taking a history, palpation, treatment, communication, everything like that, to really make the shift from being someone that just provides services to someone that truly solves problems. The link to download that is in the description box wherever you're consuming this video. And I appreciate you watching, and I will catch you on the next one. Bye.